Hi, and welcome to another episode of the Best Kept Secrets in Healthcare Show. So today's topic is trigeminal neuralgia. Now, if you've not heard of trigeminal neuralgia, be very thankful. It is referred to as the suicide disease because they believe it to be one of the worst pains known to man. Dr. Hartman, tell us a little bit about what exactly is trigeminal neuralgia. What's it about?
Yeah, so tri obviously we know means three, right? There's actually three branches that innervate our face, right? We've got a nerve here, here, and here, and that's where we get those three nerves. That's where we get trigeminal neuralgia, and neuralgia means, nerve pain, right? So, what happens, we've got nerves that branch off our brain stem and innervate those areas. But again, going back to what you were saying, when we have damage or we have this quote-unquote diagnosis, it feels like there's been an ice pick to the side of your face, right? It's also known as, chewing on aluminum foil is the pain sensation. And every single person that I know that I've seen with it in this office, I'm sure Dr. Drury, he's helped hundreds, they always have either 9 or 10 out of 10 pain when it's at their worst. And you see the events in their life that they've been able to miss out on. I remember our last woman that just started, she said she had to step away from her grandson's high school graduation because the pain was excruciation so much, and
it can hit anybody, any age, male, female. I've seen a mixture of both. I mean, it's just those people are usually pretty desperate.
Yeah.
And one of the reasons I wanted to bring this up today is because there's a deeper message than just the TN message, right? So I've been taking care of people for 24 years. I know I've had over 100 people with trigeminal neuralgia. Some have come from different parts of the world. And I would say just about 100% I've been able to help them. I had a lady, actually 2 people here recently, but one just came in about 2 weeks ago, got her first correction. And she'd been battling it only about 3 or 4 years. I've had some 20, 30 years, but she'd had about 3 or 4 years. Her first correction that night, she went home and the trigeminal neuralgia pain was gone, and now 2 weeks later, she still has had none of it. Wow. Okay, so this kind of stuff we see every day, but this is what happened. So a couple weeks ago actually, I see on Facebook there's a couple trigeminal neuralgia support groups. And I'm members of them, and I don't know exactly how, but I'm in there, and several thousand people. And you constantly see people putting memes up about, trigeminal neuralgia and how it's the condition you have to live with until you die from it. And, it's really negative in these support groups, which I guess most support groups, that's kind of what they do.
Right.
But there's this repetitive theme that, this TN is like, just something that's going to kill you, that you basically just have to suffer until it takes your life. And so I actually just made a little post in there, and I just said, check this out, maybe you don't have to live with it. And it was just a link to our website, upcervicalspinecenter.com. And there's a section in there on trigeminal neuralgia and explains trigeminal neuralgia. There's some testimonials and stuff in there. And you would not believe the response I got. You would think these people are desperate, looking for help, and they'd be like, oh, thank you for opening my eyes, or thank you for sharing this information. I'm telling you, they went off on me. They attacked me from every angle you could attack somebody from, saying, who the heck do you think you are to offer hope? Who the heck do you think you are to tell people that that they can get relief from this? I mean, they were pissed. I was like, are you kidding me? They're like, I go to the #1 neurologist in the country. If there was any hope, he would have told me. I go to the top TN doctor in the world. If there was any hope, he would have told me. So these people actually turned it around on me and said, who the hell do you think you are saying you can actually help people or offering anybody a line of hope?
And it's really a common thread, whether it's TN or any other condition. I want to focus on the TN, but as we know, the first reaction towards truth is always hatred, right? And that's how much we've, the calluses that we've developed through thick skin of people being so, just ignorant to not even pursue looking for a solution that'll definitely, if there's been damage there, help them get results. So I want to show you what happens when someone is suffering from trigeminal neuralgia, okay? Like we talked about, we've got those 3 nerves that innervate our face, right? That actually comes from our brainstem, the very top. Now, if we have a slip, a fall, or anything that could damage these top two bones, that can squeeze down and put pressure on this vitally important brainstem, which of course houses those three nerves that innervate the face. Okay. Now there's sensory perception there, and now it's not there's pain in that area. The brain interprets that there's some sort of pain that's causing that, and it says, "Hey, you need to help me. You need to help me." But what's happening is there's been physical damage to that area. Now, all these medical specialists or quote-unquote neurologists in the world are saying, well, you've got, physical damage there. We probably need to have a chemical solution. So they offer what are they offering for solutions?
Yeah, right. Tegretol, Topamax, Neurontin. This is the thing I want you to understand. Like Dr. Hartman was saying, your face is fine. You know that, right? There's nothing on your face, right? But the brain somehow gets the sensation of pain. Now, I will tell you something. Trigeminal neuralgia does not come from a drug deficiency.
Never.
So taking all the drugs ever produced on the planet will never fix it. It'll never fix it. I promise you. It might mask it. It might temporarily blind your brain to the pain, but it's still there. The only way to fix it is to find the cause and correct it. Just like Dr. Hartman was saying, there has to be something within your body that's creating this. It's not something, there's no virus, no bacteria, nothing jumping on you from the outside. Something going on. There's a miscommunication between your face and your brain. Does it make sense? If there's a miscommunication, if your face was communicating to your brain, the sensory perception of the face was communicating properly, then your face would say, hey, my hand's touching, hey, it's warm in here. It wouldn't be screaming pain, 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 stab in the face, aluminum foil. It wouldn't say that.
You're exactly right. I mean, it's almost so simple that it doesn't make sense, especially to you viewers out there. But, when you see it enough time, you get into the emotional aspect. When you see a husband that says he can't stroke his wife's hair or rub her cheek, and, you just see tears come upon that. And then all of a sudden, when people start getting under care, if there has been damage to that area, and allow the husband to touch his wife's face, I mean, that just means everything. That is worth every single waking hour and all the stuff and crap that we get put on as Dr. Drury's experience. It's worth it for that person and that family. So if you're a person or someone in your family or your circle of influence who has trigeminal neuralgia, let them know that you saw this, that there is hope out there. And if they have damage to this area, that doctors like Dr. Drury and myself would be able to help them, as long as we find and figure out how long that it's been there and what's caused that to happen, right?
Yeah, let me get back on my soapbox just one more time, because as far as your doctor not telling you that there's hope, it's not because he's a mean guy and he wants you to suffer. He doesn't know. He doesn't know. He doesn't know, okay? He doesn't know what he doesn't know. So how can he tell you something he doesn't know? Because there's less than 1,000 upper cervical doctors on the planet, okay? And most of us are in our little practices doing our thing, and we're drawing people from all over the world, but we don't do stuff like this. We don't spend time, and when we do, we get reactions like I got on that page, so I'm kind of like, the heck with you, just keep it, I don't need you as much as you need me. Mm-hmm. Not you personally watching this, but the people that attack. So what I'm saying is just because you've never heard of it doesn't mean it doesn't work, okay? We've been doing this since the 1930s. We've been helping people, not me specifically, I'm not quite that old, but we've been helping people with trigeminal neuralgia. Now, if you have it, or you know someone that has it, or if your life isn't 100%, if you're not living life like you think you should, I don't care what your symptoms are, you need to find the cause. Find an upper cervical doctor near you, okay? If you live in the Charlotte area, we'd be happy to offer you a free consultation to see if we think we can help you. If we find a problem going on in your neck that we think is causing your TN, we'll explain that to you and tell you what we need to do to fix it. If we don't, we'll find somebody else that we think that can. Now, this is my book, The Best Kept Secret in Healthcare. Thus the show, thus the fact that you've never heard of this before. That's why right now it is the best kept secret. We're trying to make it no longer the best kept secret so we can help more people. I will be willing, if you have, well, regardless, call our office, email me. I'll be happy to send you a copy of this book, okay? We're trying to get the secret out. I think if you read the book, it'll make sense to you. I don't care where you are in your lifestyle and your health care, this will benefit. So email us. We'll give you a free copy of the book. You got anything you want to add?
Absolutely. You know what? Don't let this disease, whether you have it or your friend or your family member has this disease, don't let the AKA live up to its name, the suicide disease, and let someone else take their life, especially after you saw this message, and we could be a potential solution for that person in need. So feel free, please share this video. Comment in our section of comments. We'd love to see if we can do anything. If we can't help you, obviously, just like Dr. Drury said, we'll find an upper cervical doctor near you that can at least lead you in the right direction and get your life back.
Yeah, please share this video. I mean, there's a lot of people, a lot of our patients that come to me with TN, they say, listen, either you help me or I'm going to take my life. Okay, I've had that happen over and over and over because they just can't live like this anymore. And so we need to get this out there because maybe you don't know people with TN, but you probably know people that know people. We need to share this. We need to get the word out because there's a lot of people out there suffering needlessly. And they just because they don't know, just like their doctors don't know. But we're going to change that with your help. So thank you for tuning in. If you want a copy of the book, like I said, I'm offering it to you for free. We sell it in the office for $18. I'd be happy to send you a copy. I just want you to know, learn more about your body, and do the best for for you and your family. Thanks for tuning in. Please share this. Go to our YouTube site. Subscribe. We're going to put videos like this, best kept secrets across the board in healthcare every week. And subscribe so you don't miss an episode. So thanks for tuning in. We look forward to seeing you on the next one.